Hi everyone, my name is Lourdes. Welcome to our Thursday webinar series. Glad to have you here today with us. As always, we encourage your questions on this topic, but please make sure to enter them into the chat or the Q&A, and please make sure to make them general in nature, not specific to your particular situation. I'm very glad to have Leslie Swanson here. She is a board certified nurse practitioner who currently practices in GI oncology at Fred Hutch Cancer Center. Thank you, Leslie. Looking forward to this topic.
Thank you so much for having me. Like Lourdes said, I'm a nurse practitioner. I've worked in GI oncology here at the Fred Hutch in Seattle, Washington for 8 years. And I've had the pleasure of serving on the Cholangiocarcinoma Foundation's Nurse Advisory Board for, I think, going on about 3 years. The pandemic, I kind of get a little confused about when I actually started. I am in no means an expert at self-advocacy and resiliency skills. These are some of the practices and things I've discussed with patients over the years and things that I've seen worked well to try and some of my own research to try and provide patients and family members as they're going throughout a critical illness on ways to kind of develop self-advocacy and resiliency. I think we can all think of reasons why that this is an important topic. But we know that if you have self-advocacy and resiliency skills, you can handle challenges better, you're able to take care of yourself better, and you can keep moving forward, and even when things are really tough. So we'll start by looking at self-advocacy. So self-advocacy means, or here's one definition. Self-advocacy is the ability to articulate one's needs and make informed decisions about the support necessary to meet those needs. I think we think of self-advocacy in a couple different ways, and a lot of this is going to all just look at in relation to a cancer diagnosis or in your healthcare. And so what does self-advocacy mean in the setting of healthcare? And what it really means is you are an active participant in your own healthcare. It means that you're making sure that your voice is heard. Sometimes I think, especially when there are a lot of unknowns, all the external stress that comes with a new diagnosis, the symptoms that comes with that, it can be very hard to make sure that your voice is an active part of that and you're speaking up for yourself. You know, part of that means that you know what your rights are, you know how to ask for help. You know, you want to be treated with respect and fairness. And so we'll kind of go through a couple different values on how we can empower that within ourselves. So we'll start with 3 values of self-advocacy, and I divided this up looking at it in 2 ways. One, you as an individual person, and then you in relation to your cancer. And so the first step is really understanding yourself. So what are your values? What is important to you? Sitting down, writing these out. I know where I work, we have a values worksheet that we can give to patients to kind of help put into perspective what things are important to them. This could be in terms of, you know, your relationships, into symptoms. You know, as you're going through treatment, what are the things that are most important to you, and how are you going to balance that? You know, looking at goals, I think it's really important to make those known to your care team. As you're going through treatment, your team is going to want to help support you to feel as good as possible. And it also gives you a positive sight on the horizon if you have a special event or date that you're trying to, you know, meet. And then when you hit that one, add another one. Take the time to set up fun things to do. You know, keep yourself trying to achieve that normalcy as much as you can. And then I think it's also important, you know, to discuss with your team what's important to you, how you want to be treated, how do you want information discussed with you. I think we all have been there when we get, you know, the initial diagnosis. It is just a hurricane of information. You're not ever going to be able to remember all of that information. figuring out, how you're going to ask questions and continue to in subsequent visits as kind of the hurricane starts to dissipate. You start to be able to retain more information. You start to think of, well, I don't actually know. Let me ask that again. And so, making sure that you can have those open-ended questions, talk with your providers, your nurses. I think it's important to understand who's on your team, who is your main point of contact. How does the team work together? How are they communicating? I think that as the teams get bigger and bigger, sometimes it's harder to know who do you reach out to. Does your team extend beyond the normal hours of clinic? Really kind of knowing the ins and outs of who can you go to when you need some help, or who do you go to get answers and questions, or questions to answers. And then I think I kind of already blended this a little bit into in relation to your actual diagnosis. So do you understand your diagnosis? I get the benefit of seeing patients when they come in to initiate treatment. So they've already had their initial consults where they've had the diagnosis, they've talked about what treatment options are available. And I will tell you more often than not, that information goes right over your head as soon as you get that diagnosis. It's very hard to take in all that information. And so it's okay at subsequent treatment appointments or visits to say, hey, I don't understand. Can you explain this to me again? Or asking if it changes as you're going throughout your therapy, right? This is not one linear trajectory. Things are going to go up and down, and we might need to change course. We might need to pivot. And so I think anytime you're having a change or something seems different, it's okay to ask those questions again and say, hey, I need a clarification. Where are we now? Where are we going? Understanding treatment options. And then overall, I think understanding what are the goals of treatment. I think a lot of things just kind of going back to values in terms of you as a person and your values as you're going through cancer therapy, the things that you want to consider, quality of life, independence, being comfortable, pain-free, what things are important to you when you're blending these two things together. So the next value is knowing your needs and support. Like I said, in those initial visits, information overload. So how can you make sure that you are going to be able to have as many ears as possible so you can hear all that information to bring home and then to discuss later? So building a support network. I think it's important to designate someone who is able to accompany you to appointments. I know that's not feasible for everyone. Even if it means that they can call in. I think everyone has their own opinion of that. I would ask your provider in the visit, is it okay if someone calls and listens? But my hope is that they would say yes, right? Because the more ears, the better. The more that someone can write something down. I've heard many times, well, I heard this or I heard this. And so it's nice to be able to kind of have that conversation about what's your understanding? What did you hear? And so that you can reference that later. I think there are often people who will say that the outpouring of support once a diagnosis happens from friends and family wanting to help. And I think that that can be very overwhelming for patients. Often patients don't want to ask for help, or it feels weird to have people offering a lot of things. It's okay to take them up on that. I usually tell my patients, give them an example of what would be helpful. Like say, hey, it would be really helpful if you could drive me to this appointment, or it would be helpful if you could come sit with me for a little bit of time just to chat and kind of talk about anything but my cancer diagnosis, right? So giving them a tangible thing to provide help, and then what would also help you, what would help give you support in that way, picking up groceries, whatever it is. I think it's important to also recognize that our needs are evolving. What we need now may not be what we need in 3 months. And so we need to be able to reevaluate over time. And then, leaning into your strengths. It's, always thinking about what helps you get through tough times. I think it could be various. I've had patients who are family members who are architects or engineers, and they tend to be the very like word for word note taker. And then you have people who are like, well, I love to cook, so I am going to make bone broth. I'm going to make all of these things, have them frozen and have them stored up for you. Really leaning into those things that are your natural strengths to try and help get you through the times where you don't necessarily feel like you can, you can do it. Because you can, you just need to kind of pull yourself together, pull all the network that you have to try and like optimize those things. I think part of this too being, keeping records. And so it's important to track your medications, your appointments, maybe notes about your condition, like what's going on in between visits. I think what I find is a week, 2 weeks in between appointments can feel like not enough time, but by the time you sit down in the chair and the provider's in front of you saying, well, how was the last week? It's kind of hard to remember all that information. And so may be helpful to kind of write some notes and say, well, on this day I felt this way, or, I took this medication and I felt better. And that need may evolve over time. You may not need to take as many notes. And that may also help you to be like, well, look how far I've come. Look how much better things are getting. I'm not having to take notes. I feel better. And so I think just kind of leaning again into those strengths, those things that can help you, is just very valuable. The last thing, and I think this is probably the most important as well as the hardest thing, is communicating your needs to others. Personally, how do you prefer to communicate with your team? I think the electronic medical record is great. It's easy to, we've got apps on our phone. We can send a message to our team saying, I don't feel great. But with that being said, the response may not be as quick, right? And so do you, if you send a message, you don't hear in a certain period of time, do you know who to call and pick up the phone and have that question, be able to get some answers? Do you feel you're receiving adequate information to make informed decisions about your care? And this kind of goes back to that initial value. Do you understand your diagnosis? Do you understand your treatment options? Speaking up about symptoms or concerns. Your care team really wants to know how you're feeling, even if it seems small. And so, I often tell my patients, when you leave the clinic, given, the general experience of chemotherapy, the understanding of how to take support medicines, I'm going to assume that you are doing okay. And so I really need you to reach out to me if something feels weird or it's not okay. And so it is that two-way communication. And then setting boundaries. I feel here it's overwhelming. There's a lot coming at you, and really being able to say, like, I need to set this boundary. I need to give myself some time to take in the diagnosis, take in the treatment, and then reaching out as you feel ready. As we think about how to communicate with your medical team in particular, nurse practitioners, nurses, even the MAs, your physician, surgeons, rad-onc, the teams get big and big and big, preparing questions ahead of time, writing them down, thinking about, what things do you want to ask? What things were not clear? I think it's important as you're going into your provider visits to set kind of like an agenda, right? Like, what do you want to get out of that visit? What's important that day that you do not want to leave without getting answered? I think it's really important to feel comfortable in the relationship with your providers. I think in general, oncology care attracts compassionate people, but not all personalities mend. And so, if you don't feel like you have that trust and that comfortable relationship with your provider, I think talking and saying, these are the things I need, like maybe we can work on that. But I also think, second opinions are okay. I don't know all the answers. I know what we're doing here at Fred Hutch. I tend to kind of know what we're doing in the Seattle area, but I don't know what they're doing at all the cancer centers in California. I don't know what they're doing in Texas or all over the place. And if you have an opportunity to go somewhere else and they have something that they can offer you that I don't, I'm okay with that, because I want you to get the best care that you can get, that you need, and that your team is here for you when you come back or if you need something from us. And I feel that that should be normal for all providers. I wish it was, if it's not, because we don't know everything, and it's empowering for patients to feel that they have a word, that they can go and do some research and be like, hey, I found this thing, it sounds really interesting. And if it brings you hope and it brings you someone else who may open that door, I say go for it. I think that's that collaborative relationship, referrals. I think, at least I'm very lucky to work at an academic center where we have a lot of additional resources for patients. I know that these can be found in the community as well. And so, realizing that cancer care is not just treating the cancer. You are an entire human. There are so many other aspects that go into treatment, nutrition, palliative care, which is scary. People get afraid when I say palliative care, but I often tell people it is just an extra layer of support. It is people like me, like your doctors, who get to spend whatever time's allotted to your visit to focus solely on supporting you in whatever way you need. Is that symptom management? Is it having conversations about goals of care? Is it talking about emotional support for you or your family? It is just a wealth of information and support that I feel, and there's data to show that early involvement of palliative care improves quality of life and outcomes. And so it feels like a no-brainer to get every patient involved with palliative care. We also have psychology and social work. Anxiety and depression is normal. We know that as you get a new diagnosis, that those symptoms and those feelings, they're going to go high. Situations change and evolve. So hopefully we kind of get into more of a normal state. It's not impacting our ability to eat, sleep, different things, but it's a chemical imbalance too. So it may not change. And it's okay if you need help for those symptoms. Your providers can help you. Palliative care can help you. Counseling can help. And so I don't want people to be afraid of stigmas around anxiety, depression, around cancer, around treatment. Like, these are things that unfortunately happen, and we can help manage them, whether it be through meeting with people, medications, and different things. And so, kind of just a summary of some tools and tips. Don't be afraid to ask questions. There are no dumb questions. You can ask questions over and over again at multiple visits. I think we're never going to be able to understand and make good decisions if we don't know the answers, or what we're dealing with. One of the phrases that I try and tell patients, and I actually even use myself, is, give me a minute to collect my thoughts. In visits, you can be giving, or a provider can be giving information, talking about things, and, emotions pop up, thoughts pop up, and you feel pressured to start talking, fill the dead space after someone stops talking. And it's okay to say, hey, I need a minute to think, and really kind of gather what you're gather those thoughts, come up with the questions. And it's okay to send a message in later and be like, hey, I had a chance to rethink about this. Could we address this either at another appointment or, when you have time on a phone call or something like that. I kind of already talked about this one, but, second opinions are okay. And it's okay to advocate for yourself. You are an integral part of making the best decisions for you. You know yourself best. And so, it's important to be treated with respect. You are allowed to have all your questions answered. You are allowed to understand how decisions are made, and to stand up for yourself. I didn't really put any slides on this, but self-advocacy extends to And we'll talk about emotional resilience, but it also extends to the family and the caregivers, right? You are taking on a lot being there for your loved ones who are going through treatment. And so, understanding what resources are there for you while you're going through this. How are you going to take care of you? Because you can only support someone as much as you are taking care of yourself. And so you have to be able to take care of you to be able to take care of someone else. The internet's a scary place. There's a lot of stuff out there. Not all of it's true. I tried to put some independent research suggestions below or on this slide. The NCCN are guidelines. It's the National Cancer Comprehensive Network that basically takes all the treatments and regimens and workup and all of that and kind of puts them in guidelines for providers to be able to sequence, did you do all the workup for this disease? What things to consider, and then kind of the treatment stratification as new therapies are coming in and how you align all of that. They also have patient guidelines, so they can go over symptom management, kind of what to expect with your diagnosis and workup and subsequent treatments. The American Cancer Society, again, has a lot of information about terminology and treatment options and symptoms and management. So that's a great place to start. You are all already here, but the Cholangiocarcinoma Foundation has a lot of great information too. And then we have the clinicaltrials.gov. So this is a place, and I believe one of my peers on the nursing advisory board had done a deep dive in how to kind of utilize this, or this is something we had talked about, and how do you input information to kind of look to see what trials are out there, what's coming down the pipeline. So those are just a few places. So we're going to pivot for a little bit and talk about emotional resilience. So let's see. Resiliency is your ability to bounce back after tough times. It's about staying strong even when things don't go as planned and learning how to keep going without giving up. Eleanor Roosevelt wrote that we gain strength and courage and confidence by each experience in which we really stop to look fear in the face. We must do that which we think we cannot. Resiliency really, emotional, physical, it helps us cope with stress, setbacks, or changes in your health. It's about staying grounded and hopeful. So some key skills in developing resiliency, particularly emotional resilience, focusing on what you can control. Even small choices like rest, hydration, daily routines, that all makes a difference. There's so much out of your control that it's really a huge step in being able to continue to take a step forward when you know that you're doing everything you can. Practicing self-compassion. It's okay to feel overwhelmed. This is overwhelming. It is a lot. And be kind to yourself, especially during those hard moments. It's okay to have a day where you just don't want to do anything. You need to allow yourself to just be, right? Do something that makes you feel good, something that brings you joy, warm bath, reading a book, taking a nap, not ever changing out of your pajamas, whatever it should be, be kind to yourself. Build a support system, friends, family, support groups, mental health professionals. We can't have resiliency if we're alone, right? So being in isolation is not going to help. And so kind of leaning into those people that want to help you, leaning into people who make you feel empowered and want to give you that hope and strength to continue going. Setting small goals. So achievable steps can boost confidence and give you a sense of progress. So I know I talked about before making sure that your providers know about special dates, milestones, things that you want to meet. But then these also, small goals here and there. Often, I think in diagnosis, most of the time people end up in the hospital, and that's an easy way to get deconditioned. So how do you start to set small goals to get building back strength? Are you walking to the end of the driveway and back? Going out on a walk around the block, like just setting these small, attainable, measurable goals where you can see how you are gradually improving, and then set another one. Staying connected to purpose. I think it's hard, and often I find patients who, when they see friends they haven't seen in a while, they will say things like, "Oh, you look good," being surprised, or whenever they see them, all they want to talk about how treatment's going and how things are going. You are so much more than your diagnosis. And so, staying connected to hobbies, faith, personal goals, having meaning helps you keep going. This is only one part of you. And so how are you going to keep that other part as normal as possible? Keep doing the things that you love, the things that bring you joy and happiness, and help keep your sense of identity. Some tips and tools for resilience. This one's hard. Balance between hope and reality. I want you to know that your primary team is always there for you. They are hoping for you. They are working for you. They want to give you as much time, as much quality, and they will do everything they can for you. But we also need to be able to help with self-advocacy, give you the information to make the best choices for you. I don't ever want to squash anyone's hope, but I also need to make sure that you understand your diagnosis and what we're doing and why we're doing it, because that's the only way that you can make the best decisions for yourself. Acceptance, understanding again that you're doing everything you can. This is talking about control and leaning into a little bit of like scan anxiety, which I hear so much about. Is those scans are going to be what they're going to be. You came, you did your treatments, you put up with the side effects, you showed back up for your next treatment, you called in with questions and concerns. You have done so much. And just understanding that you are putting so much into it, that is valuable. And it really helps you keep going. And I can't say this enough, but taking the times to do things that bring you joy. I love hearing what patients are doing. I love hearing about new grandchildren that are being born, or family weddings, or living vicariously through fun travel adventures. Even experiencing things in the city that we've lived in forever and being like, hey, I went and explored this new thing. It's powerful stuff, and patients you make an impact on your providers every day. We built, we'll tell a little story and then I'll ask questions, or ask for any questions or comments. But we built a new building where I work, and I had a patient who has unfortunately passed, but they were able to watch from our old building, the new building being built every day for like the year that they were getting treatment. And as we were opening up the new building, their one final wish was to be able to come in and see, we have like this vending machine for cars. So essentially you drive your car in, you get out, and it moves it down into the parking garage. Anyway, you can see it from a window, and that was the one thing that they wanted to see. And I remember a lot of things about this patient, but being able to facilitate that for them to come see that, because it brought him joy and it brought his family joy, and things may not have worked out as we would have all hoped in the long run, but he lived fully, and he was able to see those things, and it'll stick with me. And so, I think open communication, fostering relationships, it's how we get through, it's how we advocate for ourselves, and it's how we continue to show up every day. I'm happy to take some questions. Again, not an expert, but these are some tips and tricks.
Thank you, Leslie, so much. This is great. We did have one person who I think is referencing the sheet you mentioned that you guys have, but she was asking if she can get the list of values. I think you mentioned there was a sheet that you guys use at your
Yeah,
center.
I'm happy to share a copy of like what our value sheet looks like. I can I guess I can give it to you, Lord, then you could send it out.
Perfect. Yes,
Um,
that's perfect.
yeah, and so.
If anyone has questions, feel free to enter them into the chat or the Q&A. I guess one question that we get asked a lot is in terms of even recording. I know you mentioned having somebody call in or taking notes during a medical appointment, but maybe even like recording the visit so that they can replay it later.
Yeah, I mean, I think I would ask the provider that you're having the visit with. I've had patients who would ask me, and I'm personally okay with them recording, and so I've said yes in those situations. Especially, if it's going to be helpful for them to listen to it or provide it with a family member who was unable to attend. I know that like our initial consult appointments, we used to record the conversations because again, it's a lot of information. And so we would provide patients with a copy of that recording to be able to listen to later. So yeah, I think it's worth asking. All I can say is no. But if it's going to be a useful tool, I think it's worth exploring.
Perfect, thank you. And then somebody's asking, will this presentation be available for us to share? I know sometimes some presenters share and others don't.
Oh yeah, you can have my slides. I can send them to you.
Okay, perfect.
Yeah.
I don't see any questions coming through at the moment, but if anyone does, again, please just enter them into the Q&A or the chat. Can you share, Leslie, maybe a little bit about how a patient and their family can self-advocate for a second opinion if they're worried that they might hurt their current provider's feelings by, asking for another opinion and wanting to be open about their seeking of another opinion?
Yeah, and I think there's probably two different ways that I'm like envisioning this. So I work again at Fred Hutch, and so we have 12 oncologists in our GI oncology practice. And typically, I would say you're not getting a second opinion within the same organization. It's usually outside, right? And so there may be some logistics where I talked a little bit about how the relationship feels. I think like my organization, you can change providers at least once. So I think if it truly doesn't feel like a good relationship that way, exploring what your internal organization says about changing amongst other oncologists if there are others. Usually that's through like patient relations or something similar within that organization. In terms of like an outside opinion, I've seen it a couple different ways. I've seen patients who will say like, well, I have family who live in Texas, and they have access to be able to go down there. They would like to go to MD Anderson or somewhere near something, UT Southwestern or something down there. They would like a referral. And I think they could just say, hey, I'm going to go stay with family and I want to take the opportunity to make sure that I'm on the right track, or that maybe this cancer institute doesn't have a different trial that I could try, especially since I would have the means to be able to live there if you're visiting someone. And so I think, kind of setting it up that way. Other ways I've seen it too is if patients are going through like clinicaltrials.gov, have found something that's at, Dana-Farber or City of Hope or the Huntsman Center in Salt Lake, and saying, hey, I saw that these places have this specific trial that maybe is targeting my HER2 that I have on my molecular testing. I would like to be able to go talk to them about it. Can you put in a referral? A lot of places too do self-referrals. And so you can actually call that cancer center and be like, hey, I've been diagnosed with this. I would like to come or have an appointment for a new patient consult for these reasons. And so, you can always let your provider know, say, hey, I'm having a second opinion. Often we have to have paperwork that's like a release of information to be able to send whatever we've done somewhere else. And so it is nice to let your provider know so that they can send that. But I really think that if someone is offended by a second opinion, that's on them. I know that's hard. But you are allowed to go wherever you want, and you are allowed to get all the information you need, even if it means that other cancer institute says, hey, you're doing everything that we would do. At least it also like reinforces that resiliency that you are doing everything that you can do. And I don't think that's ever time wasted if it feels like it's fulfilling you.
Great, thank you so much for that. And I know that you mentioned mental health and you want to try to like make sure there's no stigma involved within anxiety and depression that patients may experience during their diagnosis. Not everyone has insurance that covers mental health services. Are there any other options that you know of or you would recommend to someone who maybe wants to seek out mental health services, but they can't afford it?
Yeah, so I think probably I would see what resources your institution has, because I do know that like my social workers are able to do counseling. They may not be licensed psychologists, they can't prescribe, but social work does have the means to do some patient counseling, so they may be able to help support you in a way that may be covered by insurance, because it's more of a social work thing rather than actually like a psychological service. Same thing with like spiritual care. You don't need to be religious to access spiritual care, and spiritual care I don't believe charges. And so it's a resource that you might be able to kind of just talk through feelings, how how you're processing things, how you're thinking. And so kind of just seeing what other resources your institution may have that could kind of get around not doing an official referral for like counseling.
Great, thank you. And someone just wanted to say thank you. This will help them a lot, and that they really need to hear this. So that's just a comment for you.
Oh, well, thank you.
If anyone else has any questions or comments, we'd love to hear them or see them in the chat. In terms of travel, Leslie, while we wait if anyone has any other comments, I know sometimes patients are hesitant to schedule plans for traveling based on their treatment and things like that. And I just am looking at your summary slide about taking the time to do things that bring joy, and sometimes travel is part of that joy-filling activity. Any suggestions or tips for patients on like things they might want to consider if they are wanting to plan a trip? Like what should they ask their provider in terms of their treatment, or things that they should be aware of if they do travel?
Yeah, I think in generalities, right? So I think, a lot of it looking at the intent and duration of treatment. So typically if I have someone who I'm really trying to get through chemotherapy with a surgery with like the idea that we might be off chemotherapy, off all treatment within a year or so, a lot of the times I'm like, the intensity here needs to be maintained, and I try to avoid prolonged delays in treatment or anything that would put us off the schedule. With that being said, we work around things. Weddings, funerals, life events happen. And so, communicating with your team so that you can be there for those things that are important to you. When it comes to patients who are on treatment for a prolonged period of time, or a period of time where we don't know that we're actually going to stop, a lot of it comes into quality and being able to do the things that you enjoy. And so often, I tell patients, go when you feel well, don't wait, right? So, if you want to go, I don't know, Paris, and you're thinking, I think I want to go in September, kind of look at the dates, I'm very flexible at being like, well, let's either skip a treatment or let's push your next treatment out by a week so that you have some time, and we'll work around that. Same thing for big life events. And, I think if you have the means and it's going to make you happy, go and enjoy. You are allowed to live a normal life. I think it's always important, especially when you're traveling places, to kind of think about, if something were to happen while I'm here, what would I do? Have some brief information about either what meds you're taking, just anything that you might need to take with you, a brief one-liner of what your diagnosis is and what treatment you're on, so that when you go, hopefully nothing happens, but should something happen, you have that information so that you can kind of say, I'm getting this treatment, these are my doctor's names, blah, blah, blah. Just so you always feel kind of prepared and empowered when you go to that unfamiliar environment, somewhere you're not used to.
Perfect, thank you. I don't see any other questions. Oh wait, let me see. Can you speak a little bit more on developing resilience?
Yeah, I mean, I think really kind of, I just moved the screen back to kind of, key skills. Really, the thing about resilience is being able to keep putting one foot in front of the other. And some days it may feel like you can do 2 or 3 steps, and then one day you're barely getting that one step forward, but you're able to keep moving. So whether that's leaning on the support of friends and family, setting small goals that you're trying to obtain, giving yourself that self-compassion to be like, well, it's okay to make no steps today, or to just take a little itty bitty baby step, just kind of keep getting yourself to the next day. I think a lot of it is about, taking things day by day, and then having that goal that you're trying to get to, kind of similar to treatment, right? We take it by treatment with interval scans to assess, make sure we're on the right track, and so that we can kind of pivot and change if we need to. And really staying connected to a purpose. I think making sure that you do not let this disease define you. It is only part of you. And that you keep having, faith and hobbies and other things that kind of help keep you going.
Great, thank you. And then just so folks who are listening, also there was a suggestion on researching travel insurance policies if you are traveling. That's just another suggestion.
Yeah. And I think asking your provider, I've written plenty of notes for patients who thought they could go on something. I mean, again, we're here to help you. So it never hurts to ask and be like, hey, I couldn't go on this because X, Y, and Z. Can you help provide a letter saying that we couldn't do that? Like that's easy. Like I want to help you as much as I can.
Great. Thank you, Leslie, again. I don't see any other questions, so I appreciate your time and sharing on this topic. And if anyone has any questions on this or anything else, feel free to email advocacy@curecca.org. We're happy to help answer questions and redirect to other organizations or supportive services, definitely. Thank you, everyone.